most of these comorbidities related to cardiovascular issues are like silent killers. So the only way to know them that you have it in you is to do regular evaluation. So therefore, if you look at the chairman's vision, Dr. Pratap Reddy's vision, that how he has created a proactive health group where health checkups and all, where because otherwise in this busy life we feel that unless we have symptoms, why should we go to a doctor? But people fail to understand that there is a very, very long course of asymptomatic phase. So the blood pressure will not cause symptoms for very, very long until unless there is a complication, people don't have symptoms. So the most important thing is that we go for regular checkups whenever we have the opportunities. There are so many corporates which conduct regular health checkups in the various corporates, and people, whenever they are going for even for basic illnesses like cough and cold, they should get their blood pressure evaluated. As such, BP machines are easily available, they should get evaluated. Similarly, the blood tests have become so common. People can call up the lab, people can come, and there are various health checkup programs which are available. So this is the most important part, that don't wait for the symptoms to occur and then take action, which is our normal psychology, human psychology, that why should we go to a doctor when we don't have any symptoms. So this is very important to diagnose these comorbidities in the earlier stages and then start acting. Now, as you were saying, what should they do to prevent further progression of these comorbidities as well as other comorbidities coming into our life? Because the studies have shown, as I was telling you earlier, that people with high blood pressure, they have higher chances of developing diabetes. So once a person knows that they have developed high blood pressure, they have to become proactive in detecting these other risk factors on regular basis. So once in a year, I think everybody should go and check them, especially after the age of 40 is for sure. But even if you do at an earlier age, because we are seeing heart disease in a much younger population in our country, so we can be proactive. The international guidelines says that you should have your first checkup related to your blood pressure, cholesterol, your blood sugar at the age of 20, and then every 5 years, and then after 40 you can do every year. But in India we can change this guidelines and we can make it little more earlier, because we are seeing heart disease at the earlier age. Now, because they arise from the common root hypothesis, if you start taking proactive action in terms of your diet, exercise, your sleeping habits, which we will discuss in our discussion if we have time, they will have beneficial impact on all these comorbidities. So if you start taking good action like diet and exercise plan, if you are a diabetic, it is going to help you to prevent development of high blood pressure. So this is the importance of identifying early and then regular surveillance to pick them in the early stage and take proactive actions.